All right, we're finishing out the spines with thoracic spine. I think the only thing we have left spine-wise is scoliosis. So, you are probably sick of hearing me say this, but review those landmarks for me. T-spine routine. So, T-spine routine, you're going to do 3 views, AP, lateral, and a swimmer's. We'll go over technical factors a little bit later on. AP T-spine. Most likely your patient will be supine. Your central ray is T7, just like a chest x-ray, 3 to 4 inches below the jugular notch, which is what they're demonstrating here. This will be taken on expiration. I suggest doing a small triangle of light over the shoulders, really similar to chest. Obviously, if you have a really big patient, just like chest, you're not going to have that triangle of light. But your smaller, thinner, slender patient, you're going to have that triangle of light. I like this picture with the exception of this pillow. Please don't keep a pillow underneath the patient. You can see how it's way under his shoulders. All those pillow creases are going to show up as an artifact. So take that out. It also raises their head up depending on the thickness of it. I know our hospital pillows aren't super thick, but they can actually tilt their chin down. And if they're kyphotic, it makes it even worse. So take that pillow out. You should see from C7 to L1 included. How do you find L1? You look for the last thoracic vertebrae, which has the rib attachment on it, and then L1 is going to be right after, okay? Just some anatomy pictures. You guys can go through your anatomy. I always think the pedicles look like eyes, like owl eyes, and the spinous process looks like a beak. Now you're not going to be able to unsee it, but there's something called the winking owl sign, as the radiologists deal with that more than us. But it's suggested that it's an early sign of metastatic cancer. So the eyes are your pedicles, right? And the beak of the owl is your spinous process. So the eyes should be fully open. And if they're not fully open, if it's squished, that's a sign of metastatic cancer. Lateral T-spine, same central ray, just like chest, going to T7. You can use that chest hand technique where you find the vertebral prominence and stretch your hand out to find T7. This is one of the exams we will use that orthostatic breathing. So the patient's going to continue to breathe and we'll increase our time to blur out the ribs. The top of the light hits just underneath the shoulder. We're going to do the swimmers to get the top here. So you're not going to have light up to their ear on this one. Most of the time, the light for me is just underneath the shoulder. Get those arms in front and always check, just like lateral lumbar, from hips all the way down, from shoulders, all the way down to hips, making sure they're in true lateral position before you even get centering, right? Make them get it pretty first. What do you want to see? Well, you want to see a lateral thoracic spine. Ideally, no rotation. And remember, lateral T-spine and lateral chest are really similar. If you think of lateral chest, how do you evaluate for rotation on that? Well, you're going to look for those posterior ribs. Are they superimposed? Are you seeing a lot of posterior ribs coming out here? Can you see double vertebral borders? No. We want those arms up and out of the way, which is ideal. All right. Anatomy picture, rotation. This is a good demonstration of rotation. See how these posterior ribs are coming way out, these big C's here? That's a good amount of rotation. They are bigger down closer to the hips, so the hips were way more out rotated than up here at the shoulders. It's a little smaller at the shoulders, but still not pretty. It can be done upright if requested. This is too high of a centering light. It should be down here by the shoulder because you're going to do a swimmer's view anyway. Compression fractures, I think we've gone over this already, but if the vertebrae is compressed or squished, that's what it'll look like. It's going to lose height and kind of come in at the middle. So that's what those are. We'll often see those in elderly patients. Swimmer's view. Centering wise, textbook wise, is central ray to T1. Clinical wise, our radiologists want the top of your cassette to include above C1 so they can count. So that's one of the variations that you might see at the clinical site. Remember, for tests and boards, you have to go textbook. Center ray is a T1. We do a swimmer's view to look at usually T1 through T3. You're going to raise the arm closest to the image receptor and then drop the shoulder that's further away. They're going to hold their breath. Okay. You might need to add an angle down if they have big shoulders. This patient is laying down. I find it sometimes easier to lay my patient down, depending on what difficulty they're having. And then this was just an anatomy image here of a swimmer's view.